Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
which I thought was surprisingly high. But you guys think it's low, huh? But yeah,
Yeah.
then there's a great article on loneliness, which I'm sure many people have, and we talk about the fact that you can be among people and be very lonely, and you can be with people and not be lonely. So, what determines whether you're lonely or not? The question. What determines whether you're lonely or not?
I guess a diagnosis from your psychologist.
Now,
No,
we're
well,
not asking for your psychologist, asking you, how do you know when you're lonely without having a psychologist?
if you feel lonely.
It's an emotional need.
Yeah, that's right.
If
Right.
you don't connect.
Yeah,
Emotional.
yeah.
You know, if you feel lonely and you got 1,000 people around you, you are lonely.
So they talked about the fact that they had a seminar for loneliness, and they had more than 2,000 people show up online for a seminar because there's so many lonely people in the world. And they talked about there was loneliness causes sickness, as we all know, but it causes strokes, it causes heart attacks, it causes obesity, it causes many things that are undesirable. And the question is, what do you do about it? What, you're lonely, and what, are you lonely because you're surrounded by people who you don't like, or are you lonely because you are alone, or why are you lonely? And they talked about the fact that some divorced people by design are not lonely at all. They're happy to be free from their spouses. And there's some people who are widowed, and they are very unhappy and lonely. So as you're mentioning, it's kind of up to you. And they talked about what are the ways to address loneliness. And what do you think are some ways to address loneliness? No
Stay
idea?
busy. Stay busy.
Busy doing what?
Anything. Involvement. Talking.
And
Shopping.
volunteering.
Volunteering.
Yeah, right.
What about having somebody move in with you?
Say again?
You either move in with somebody or have somebody move in with you.
That depends on who you have moving in with you.
Yeah.
Are you compatible with that person? So
Some people companion dogs or animals that you like to associate with.
Right.
yeah. And you're pointing out that there's many ways of overcoming it. And as you said, some people have companion animals. And some people start by meditating. And mindful meditating is one way of doing it. And another simple way is you're all talking about connecting with people and expressing gratitude and giving thanks to people for whatever they do. And then you all mentioned it already, having an authentic connection with somebody that whether, and of course, this group is a good example of connections. And so group meetings are another good way of establishing connections. But what is most interesting is the number of illnesses that are associated with being lonely. So it's important to connect with people, to share with people because it's healthy. And I think it's, you know, I think of Flavia, who has a number of groups that she participates in, and helping people. And helping people is another way. So those are ways to address one of the commonest problems these days, especially because of COVID. Then the other thing that I wanted to point out is they talk about how are you going to be safe for the holidays, you know, and is it okay to party hop, go to different parties? And one of the most important things that in this day and age is who you're going to party hop with.
Yeah.
Are they vaccinated? Have they had the booster shot? All of those things factor into it. Are they going to be socially distancing? Are they going to, is it inside? Are you going to be wearing masks? And what do you think? Is it important to have family gatherings now?
I don't think it's much better than last year. Obviously, everything's opened up. We're out shopping. We're out. But to have those big gatherings in a closed environment in your home, I don't think we're any better than we were last year. We still have to limit or stick to a bubble.
What I think about it is it's more important to have family gatherings now under COVID.
That's true. It's important to have them. How you have them becomes critical.
Yes, with us for the holidays, one of the things that we got involved with is Zoom sessions. And my mother-in-law, we have provided her with the GrandPad, and that's a means of connecting with them. And we had a good time Thanksgiving with having those types of social media things available to us. I think we had about 3 or 4 different Zoom meetings and different sorts of social media meetings.
Any other thoughts? I think safety is one of the important things. What about these dips that we used to have? Can we still do that again?
Dips?
Yeah, chip and dip things, you know.
Oh, yeah. You
Answer
just don't
is no.
double dip.
Answer is no. Still not safe.
You can't give gifts?
No, dips.
It's unwise. It is it's unwise and it's unsafe.
Do chip and dip.
Right.
Right. They're still saying avoid it.
Weren't you supposed to avoid it in the first place?
Somebody made it.
Well, we didn't avoid it before, but we need to avoid it now. Some would have argued, as you say, that it wasn't that great in the first place. But
I think that before pandemic, you would do chip and dip, which means you're going from chip to dip. Now, and I didn't always do this in the past, have that spoon in there to use it, or not have as many dips. I'm aware to put something in there to use where you're not putting it in your mouth and back into the dish.
yeah, well, it's probably wisest to avoid it if you could. In this environment, at least now. Should you be around people who are not vaccinated?
No.
How
You know,
risky
but
is
it's so hard to ask relatives. I got some relatives, and I've just found out that they get so adamant about not getting the vaccination, especially some of the young ones. So I feel like, and then they want to take trips, and then all of a sudden they can't go on the trips because they're not vaccinated. And I don't know what they're doing, but there's a whole clan of relatives I know. And they usually, sometimes a long time ago, they would come over, but this year I just feel like telling them, which I will indiscreetly, you haven't been vaccinated, so don't come.
Yeah, well, that's a sensible thing to do. It may be unpopular, but your life is at stake. So How about indoor performances?
Uh-huh.
Okay, John and Darryl.
Well, I'm waiting for this.
I've been doing it since September, and I've been more comfortable now because in order to get into these venues now, they're requiring vaccination cards. People who don't have vaccination cards, one of the venues had ability to get tested right there, and 15-minute tests, and as well as the PCR test, which comes back in 24 hours. But I'm going to be playing. I did a Messiah on Sunday evening, and the parishioners had masks. The performers had masks, except for the soloists. Okay, when the soloists came up, they took their mask off. When the preacher came up, they took their mask off. The conductor had a mask. All the performers had masks, but the trumpet players had to take their masks off to play. I'm doing both. I'm doing brass and keyboard and percussion. So on the keyboard and percussion, I can keep my mask on, but with the brass, I have to take the mask off. On the stage, I'll have my mask off because everybody in the band is vaccinated. I know that. But as soon as I play my last note, my mask goes on.
Sounds sensible. Any other thoughts about it? I know I've been
John,
singing.
where was the performance?
At Trinity Episcopal upon Branch, no, not Branch Avenue, Piney Branch Road.
Who is the conductor?
You know him. He was a singer. I forget his name. I forget his name right now.
Okay,
I'll tell you later on.
all right.
We've been
Talking about Kevin?
Kelvin.
Kelvin Page.
Kelvin.
Kelvin Page.
Yeah.
Oh, okay.
Thank you.
We've been singing since September with the special voice masks, and we've been rehearsing with social distancing and masking. And as just kind of as you mentioned, the soloists will take off the mask while they sing the solo, but all the rest of us are masked, social distancing. So it is more risky to go inside, but as long as you have the safety precautions, I think it's doable.
I was surprised, Dr. Callender, that you could still hear the choir. And I actually sang with the chorus, on the choruses. And I was really surprised. It was very well balanced. It's a small instrumental ensemble to go with the choir, but I was really surprised that you could actually hear. It wasn't as bright as before, of course, but musically it was very good.
Yeah, I think it's
Carol, tell them about the singer's mask. When you use those, you can hear just as well as if they didn't have a mask on.
I'm not so sure that that's true, but I think you can hear pretty good. I mean, it sounds pretty good.
You remember Sylvia's testimony the other day? She went down to hear the Choral Arts Society, and she said the diction and everything, she could hear it.
Yeah. All of us use the choral, the voice masks, and they work well. I'm not sure that they're as well as not without the mask, but it certainly is valuable. How about going to the theater?
Did they have distancing in the theater?
Yeah, they say they do. Yeah. They, and this will be a test because up until now, the masses have not been coming to the theater. So it's been easy to social distance. But I think it is important to talk to, if you have something indoors, to try to have as many people as you can to be vaccinated. And those who are not vaccinated probably should stay away, but that's a family thing. But it is so important to have the connections and the family fairs. They just probably could be smaller.
Darryl is performing also. Darryl, how do you do it?
Yeah, Darryl has never stopped performing again.
Yeah, I slowed down a little bit. Over the summer was all outdoors. Now I'm indoors, and in Illinois, there's no precautions. It's exactly like pre-pandemic environment.
Really? That's interesting. Illinois, huh? You're different. Okay. Anyway, any other comments or thoughts? Flavor, we were talking about you before you joined us, and I guess, is she gone again? But anyway, any other thoughts about this before we go into our presentations?
Dr. Callender, backing up to where you're saying that 56% of youth are obese.
Yes.
If you notice, if you go to games or anything, it used to be like cheerleaders were always the thin girls. But even when you look at the college, it's no longer thin girls. You see the big girls doing everything. Society has changed. I didn't know if it was discrimination or what. It's just like airline stewardess. It used to be everybody had to be a young female that was attractive. Now you got the saints, you got the senior citizens as airline hostess, you know, and they don't have to look that good. But things just they just they just have changed, you know, society changed. And I don't know if it's discrimination or what, but I was looking at even the Thanksgiving parade for Macy's. I was looking at the high school and the college bands that were there and the drum majorettes and all of them. There were some big girls there. I mean, they did the athletic and everything, but our society has accepted if you're obese, it used to be you had to be skinny mini and athletic to be on a cheerleading or like that. But now everybody. So I don't know if it's better or worse, but it's just different to see.
That's that 50%. Most of us are thicker now than years ago.
But I'm talking about the young people. I'm talking about high school, college, elementary. When you look at the cheerleading squad, they are totally different.
I've noticed.
Uh-huh.
It's not over till the fat lady sings.
Oh boy.
Okay, John,
that was in 40 years ago.
If we look yourself. But I'm just
if we look at architecture from years ago, doorways were a lot smaller, slimmer and shorter. Ceilings were lower. And especially a lot of the Pueblo dwellers, and even in the Museum of African American History and Culture, some of the cabins that they have in there, the slave cabins, the doorways and just smaller. We were smaller as a people, but we also got more exercise.
Yeah.
I wouldn't call it exercise. We just, we were slaves. We worked like
more active
with the whip.
Yeah, we should be exercising, but anyway.
Yeah.
Any other comments from that, John? I guess you can start the slideshow. And be safe during the holidays as we're facing them. Now, there's an interesting article about these 4 health measures are worse in women and children, which is not so good because the longest livers in our society are women. And so their health is very critical. The teen birth rate is interesting, has dropped, which is that good news or bad news?
It's good.
Probably a good, yeah, I think it's good news. But apparently it varies. And it talks about racial disparities range government 8 times higher in American Indians. And of course, Darryl talked to us about the African birth rate, which was significantly higher as well.
There's one thing about that, about the birth rate of teens. Does it mean that teens are less sexually active or they have more mechanism to keep from having children, such as abortions or birth controls? What is the cause for there's a lower teen birth rate?
They didn't say in the article.
I think that factor should be, brought in. Why is there lower teen birth rate? Like in Arkansas, they don't have probably the money for birth control, but are teens more conscious now about not having sex than they used to be with the media the way it is? I don't think so.
I think with COVID, teenagers have to stay at home.
Yes. Things are not as convenient for them now with the COVID issues.
Yeah, that may be the main reason. Then sadly, maternal mortality increased. And as we know, we have one of the highest maternal mortality rates among developed countries. And that's something that is particularly a problem in the African-American population.
What does that mean, Doc? Maternal
What does it
mortality.
mean? I mean, the mothers die more from pregnancy than other people. So that you would like to have a maternal mortality rate of 0, but that's not the case. And Black mothers face the greatest challenge, and that's frightful because you don't really talk about mothers dying in pregnancy, although my mother died when I was born, but that was before antibiotics. Now, but we still have very high maternal mortality rates in the African-American population.
Yeah, it looks like Black and brown mothers are driving that maternal mortality rate.
Darryl, I can't hear you.
Oh, it looks like Black and brown mothers are driving that maternal mortality rate.
Absolutely, which is frightening. Yeah.
Is it because of seeking help from a physician?
I don't know, because there was an article on it that indicated that if you had the same ethnicity as your doctor, you're likely to have a lower maternal mortality rate. But I don't know if it's statistically significantly different, but the data suggested that. But it is without question much higher in the African American, as Darryl has said, in the Black and brown population.
Dr. Callender, I think we talked about an article a few months ago about a Black woman, OB/GYN, who died in childbirth, and it really amplified the conversation. And even she talked about in the process about her doctors not listening to her, in spite of the fact that she was a physician.
Yeah, you remember Serena Williams had similar kind of problem.
Also read that white doctors are more reluctant to give Black and brown mothers epidurals.
Mhm.
because of the feeling that Black people have a higher tolerance to pain.
That's sad that they should be so ignorant, because we know better. And then, of course, this issue of the drug deaths, which is horrifying. Can you imagine drug deaths among women increased in 23 states?
Dr. Callender, how does SID enter into this factor?
What?
Sudden death syndrome.
That has nothing to do with this. That's infants.
You don't
This is
hear
not-
that very much now, Dr. Callender. Is that still a factor?
Yes, it is. Still occurs, but it's not as often as it was before, but it is still occurring. But the drug issue remains one of the most difficult problems we have. And I think it's because of the money that people make as a consequence of it. And so we address the mules, but we don't address the people who really are responsible for it. You know what a mules means when it comes to drugs? It means the people
carry it.
the carriers, the people at the bottom of the pile. And they arrest those people. The people who are really responsible rarely get arrested. And then it's interesting that prevalence of smoking has decreased, but women still smoke. It's interesting that Europeans still smoke. And the low earners are more likely to smoke than the high earners. And those who are not college graduates just like to smoke than those who are not college graduates. So it remains still a problem. We know smoking is unhealthy. We know that it causes cancers, and yet still people smoke. That is just like vaccine.
And what's not included in a lot of the smoking data are vaping, which has become very, very popular, especially among teens, but also among a lot of adults. And vaping is causing, significant problems and deaths.
Yeah.
The irony of that is that people that made less than 25,000 could have more money to spend on expensive cigarettes, and the more money you made, the less money you spent on cigarettes.
Right.
It seems
And
like
it's
it's been just
interesting
the
if you,
opposite.
And if you look if you walk down the street where the drug sellers, they're always selling cigarettes. Maybe only for $1, whatever, but they're always selling cigarettes. And that's interesting, as you mentioned. And this is an article I wanted to include so you could see if you feel the same way about being in the hospital as some of these people. And nowadays, staying in the hospital is less likely because they discharge you sometimes sooner than you should be discharged. But waiting for discharge is one of the things people that don't like. They like to be discharged in the morning rather than the afternoon.
Well,
And,
they always tell you're going to be discharged at 11, and at 5 or 6 o'clock in the afternoon, you're going to get out because it takes them that long.
Yeah, that's what many people aren't happy about. The fact that that is the case.
My husband was discharged at 10:30 one night.
Really?
After stay. Mm-hmm.
Well, that's awful. Yeah.
It is. It's horrible.
Yeah. And it seems like it ought to be easier to do with our technology, but it still remains an issue.
Then I saw up above, they were talking about having private rooms, because if you get a person sharing the room with you and they're moaning and groaning all night, it's worse for you because you get no rest. You get no rest anyway. But when you got to share rooms and the food is horrible.
Well, that depends where you are.
Which hospital has good food?
MedStar.
Which
I don't know about
MedStar?
MedStar.
VA isn't that bad. It wasn't that bad.
Some hospitals you can actually order what you want.
Sibley.
Yeah, Sibley. Yeah.
That's the only one I know of.
Well, that doesn't mean it's the only one, but it's certainly.
Anybody else have an experience with a good hospital with good food?
Well, we may not.
Oh, VA in the VA hospital.
Oh, okay.
VA hospital was it was actually pretty decent.
Okay. And then, of course, the biggest fear in the hospital is infection. And what is tragic about that is it's related to hand washing. And, which is very simple to do. That hand washing is the something that nurses and doctors are not 100% on, and that's a overstatement. But that's what we really have to work hard to improve.
Dr. Callender, and especially in nursing homes, I was wondering, they always talked about the UTIs. I never knew how impactful those things are. I mean, they can cause all kind of problems.
Well, yeah, well, of course, urinary tract infection is one of them, but blood infection is a consequence of all kinds of catheters, whether it's IVs or catheters going the urinary tract or whatever, but infections by bloodstream is something that is the biggest problem. And then, of course, yeah. And many of these are all related to hand hygiene. And then this is an interesting about what they don't include in this is used to be people who were fat had a lot of trouble with being in the hospital because they treated them badly. Not only being old, but being overweight used to be a problem. Not to speak of the racial discrimination that exists.
Also, age.
Yeah, they
I don't
make
know if
first.
anybody's come across that. The
Yeah.
older you get, they act like you're senile.
Right.
And if you have somebody with you, they talk to them instead of talking to you. They did my mother the same way. They were telling me instead of telling her as if she was deaf and dumb. So it, and then I had that experience with my daughter just to get my fingernails done. And we went together and they talked to her as if I was standing there totally oblivious that I couldn't pick out the color for my own fingernails. That was extremely humiliating. But anyway.
Yeah, age and obesity are things that, and then of course the issue about gender, that's also a problem.
Would the hospital staff get any sensitivity or diversity training on a regular basis?
What was your last comment?
Yeah, hospital staff, they get any sensitivity, diversity, or age training, how to treat people, how to treat seniors?
I don't know if they have it about seniors. They have it about gender and other things. They need to do more about ages and sexes. They're beginning to do implicit bias teaching, but we've got a long way to go. Sensitivity teaching is not adequate. I'll tell you that. I just included this just to see what you thought about this. I think we all are aware of this situation where this incapacitated woman in long-term care delivered a baby. And after they did the DNA testing, they found out who was the father. And the father was a nurse. And this is the nurse.
Man.
And he was put in jail. It's a long term, I think. Yeah. And what do you think about that?
Horrible.
It's
That's just
disgusting.
straight up embarrassing.
Yeah.
Disgusting.
What drove him to do that?
He's a man. That's
Well, look at
Should
him.
have been put in solitary confinement.
You could not get a date normally.
Darryl.
He's right.
I'm with Darryl.
Darryl.
Yeah, I am too. If you look at that guy, John, show a picture of him again. If you look at that guy, he looked like somebody that just came out of solitary confinement.
Well,
So what about the gynecologist that had molested a lot of women? That has been in the newspaper. So why do you think if a gynecologist who's an educated male can do that, why can't a male nurse, no matter what he looks like? As Dr. Callender said, he's a man.
Yeah, it's a difference in your income too.
No, rich doctors have done it.
No, I don't mean income that way. I mean, a nurse can keep the media and the lawyers away from him as best as somebody who is making a whole lot of money.
but it doesn't matter for DNA testing. That has nothing to do with money. It has to do with being able to find out who's the father. And once that's done, it doesn't really matter what kind of income you have, because
Yeah, I've been watching too much TV because I see how people who have a lot of income can pay for these high-powered lawyers.
well, high-powered lawyers can't overcome the DNA testing for that situation. But in general, that statement is accurate, because when they say justice is blind, it isn't necessarily a good thing that justice is blind, because some of the travesties that occur in the courts are horrifying.
A lot of it has to do with the trust a person has in the physician. Look at the gymnastics issue, which is horrifying as well. But those young women trusted this physician. And then depending on the story you're told, and then when you report it and your responsible adults don't believe you or don't act on it, that's another issue. So it's a confounding problem, and a terrible one.
Yeah, it's one that women have dealt with through the centuries. And it's only now that people are giving it the appropriate attention.
And they only believe it because of the DNA testing. Other than that, women still wouldn't be believed.
Because of the what?
of the testing, the DNA testing.
Oh.
Uh-huh.
Well,
Women had a hard time proving anything. They always said it was her fault.
yeah, they still do, and it's unfortunate. That's unfortunate.
You know,
We've
like
got
rape
we still got a long way to go.
Right,
Mhm.
rape victims is always their fault, how they dress and etc.
That's changed, fortunately, but
Mm.
not as much as necessary. This is no surprise either that blood pressure control has got worse because people are not exercising, people are not getting out and moving about. So as the weight goes up, the blood pressure goes up as well. And small changes in blood pressure result in strokes and other problems, cardiovascular problems. So the expectation is that we'll see more strokes and heart attacks because of this. Of course, people like John Buchanan, who you still are running every morning?
Not every morning, about 3 times a week.
Yeah. More people need to do that to
And
increase the blood pressure.
not running, walking.
Okay, right. You're right. Okay. And walking, whatever.
I was getting ready to say running is something I'm not familiar with lately.
Well, running has its own problems, right? Walking is much safer. Had one of our doctors who was running and fell and broke his neck. Well, okay, I think this is something that we can do something about. That's why I started paying to your attention. We can make a difference. We can exercise, aerobic exercises, and pushing back from the table. Well, it's going to be interesting to see what happens in January because it's planned to require the federal government to actually get rid of people who are not vaccinated. It's going to be tested.
Dr. Callender, are the boosters only for the seniors, or are they recommending everyone to get a
Everyone.
booster?
They're recommending for all adults.
All adults, okay.
And especially as these new variants come up, and the boosters become even more important. So while at first it was just for seniors, now it's for all adults. Now, we talked last week about the problems with the home tests causing a blind spot for the CDC, but be that as it may, people are going to want to do home tests anyway. This is an interesting assessment. The judge temporarily blocked the mandates of course, the question is how long that will last, and of course, whether that will remain is a question, because I think it's important that that mandate be allowed to come to fruition. This is in the best interest of the country's health.
Dr. Callender, there was a story in Prince George's County. They said a whole bunch of kids were vaccinated with expired vaccines. So now they've got to come back and get vaccinated with the more up-to-date vaccines.
Well, it's
So-
amazing. It's amazing. We've gotten up to almost 800,000 people dead from COVID. Sad. I'm getting close to 6 million humans. This is an interesting study, although you wonder about the competitiveness of these studies, that breakthrough infections were more likely to occur in the Pfizer vaccine than the Moderna vaccine. Although both drugs were effective, the Moderna was more effective in preventing breakthrough infections. But when you look at it, in excess of 1.2 cases per 1,000 people, may seem small, but if it's you, then it becomes large. However, there's always going to be a question, which is better? And it appears as though the Moderna, according to these tests, is the more effective vaccine in the long run.
Both of them are a whole lot more effective than the flu vaccine.
Yeah, a whole lot more effective. The bottom line is that they're both safe. Yeah. But it's just that Moderna is a little more effective and safer than Pfizer. Well, this is an interesting article because it addresses where it came from, although where it comes from to me is irrelevant, but they are suggesting that it came from one person who was immunosuppressed, but I don't know that it matters that much. And of course, we have a couple of articles on Omicron. Now, it still is an issue that the unvaccinated more likely to die, 20 more times more likely to die than the vaccinated. And the source is more likely to come from the unvaccinated than the vaccinated. So we don't have all the answers yet, but it does look as though it is less virulent and less likely to cause death than the previous variants. But we still have more testing to do. Oh, Haiti has none. I didn't realize that, but that Haiti has nobody been vaccinated in Haiti. But then, of course, that country has no leadership at this point. And then, of course, I read where they recently released 5 of the Christians who were trying to help them. I don't know if there are any that are still kidnapped, but at least 5 have been released. Wonder how the Haitians feel about what's going on with their country now. Because they still have no leadership.
They may be afraid to think anything.
Right. Very well stated. Yeah. they're more tempted to leave than to stay. And this is a question, are we going to have a new variant every few months? Time will tell. We don't know. Will we have to be getting boosters all the time? We don't know. We'll have to wait and see. Will we have to get vaccines every year like we do with the flu? Time will tell. But anyway, it's alarming enough for you to wonder why people still will not get vaccinated in spite of all the information.
My question, Dr. Callender, is, you know, what have scientists learned since the Spanish flu back in 1918?
18.
Yeah, 1918, and so now we know 100 years more about viruses and vaccines, and how will that help?
Well, it's already helped. We've developed a vaccine. It's helped immensely. We've developed a vaccine within months, which we couldn't do 100 years ago. And how many people's lives were saved because of the vaccine? I don't know, but it's probably in the millions.
So the new thing is the variants and the strains that,
Which have always been the situation with the flu vaccine. There's always been variants. The question is, how serious are the variants? Now, this is the answer to the question, so far anyway. The impression is that the same vaccine that works for the Delta is going to work for Omicron as well. And the early information is that it is not it's not as virulent as Delta so far. But testing is ongoing. But the evidence suggests that vaccines we have are effective against Omicron as they are against Delta. We talked a lot last week about the vaccine inequities, global vaccine inequities, and they persist, which means that there's likely to have more variants. Most people believe that the solution is to try to get as many people vaccinated as possible. It's amazing how effective the airplanes are at transmitting the viruses from humans to others. It's amazing how one thing we think is a wonderful development can be a plague as well. And air travel is wonderful, but it has its drawbacks. So it looks like as soon as anything appears one place, it's all over the world. because of our ability to travel from one place to another.
I think it's more that people are not getting vaccinated. It allows it to spread like that.
Yeah. Well, that's part of it. The other part of it is that we travel. It's humans take the virus, so our ability to travel from one place to another is part of it as well.
Dr. Callender, I heard an argument by somebody that didn't want to get the vaccination. He said, well, even if I do get the vaccination, I can still get it and I can still spread it to somebody else, even if I do get vaccinated. How would you respond to somebody like that?
I don't understand. And the purpose of getting the vaccine is keep yourself from dying. And that's the purpose, to save your life. That's the purpose of the vaccine. So I think they are missing the point that, as we mentioned, nearly 800,000 Americans are dead and close to 6 million humans are dead. So that's the goal, is to save lives.
Dr. Callender, the other argument is that if you get vaccinated and you do get the coronavirus, you're going to maybe have fewer problems when you get to the hospital.
Well, not only that, you're going to live. That's the biggest issue. You're going to live. And you may be hospitalized, but you're going to live. Whereas the unvaccinated have 20 times the likelihood of dying if you're not vaccinated. So that's the real critical issue, is life and death. And this, I guess, all of this points to the fact that all adults need booster shots. That's kind of the bottom line of all of this, is that the initial shot is not enough. You need to have a booster shot.
Carol asked your questions before Bonnie got on the call.
What was the question, John?
John,
Yes.
you're not muted.
Well, I think it's very important to appreciate the fact that this may be more easily transmissible, although it may not be as lethal, but it may be more transmissible. Do you have any more of the people who are against vaccination who are changing their minds because of the variants? Haven't seen any data that indicates that people are becoming more interested in being vaccinated as these variants appear.
Dr. Callender, my daughter, who never wanted to get vaccinated, but she did, she still doesn't even want to get the booster. She only got vaccinated because of, her parents. She was coming home to visit her parents. But asking her if she's going to get the booster, she's still saying no. So,
And I know somebody like that too.
Yeah. Well,
Yeah.
Well, we have to do our best to try to educate them, but
Mhm.
guess that's all we can do.
Talked to a guy in Florida yesterday. He said he still wasn't vaccinated, but he might go ahead and get it now.
Why?
I think because of the Omicron.
Oh, I see. Okay.
But you know, Florida has one of the highest vaccination rates in the country. And I think that's
Yeah.
because there's so many old people in Florida.
Yeah. Yeah.
The elderly. I'm not gonna say old people, the elderly. Sounds better.
Seasoned.
There you go. Okay.
Seasoned saints.
Well, this just says what we've said again and again, that until we get higher vaccination rates, variants will continue to come. And it doesn't seem as though those anti-vax people are changing their minds.
A lot of them are dying, though. There was a piece on the news this morning. I believe Connecticut was one of the New England states, I believe. And the medical director said that 100% of the patients hospitalized at that particular moment in time with COVID were unvaccinated. 100%.
Wow. Well, maybe that message will get out and they'll change their minds. I'm hoping they will.
Good morning. This is Cheryl. I joined late, but I have a question. I'm not sure it was late last night when I was watching this program, but it seems like this doctor was talking about some type of, I don't know if he called it vaccination, where you're actually getting antibodies or antigens or something injected instead of the vaccine or instead of the MRA, what's going on now. And it's for people that are immunocompromised. Have you heard anything about that?
I didn't understand what you said.
Last night, it was really late and I was watching this program, so I may not have it correctly, but this doctor was saying something about a type of injection that you could get if you're immunocompromised. That's, I think he said, was giving you the antibodies or something else for immunosuppressed people. Have you heard of anything like that?
Well, they have, for example, they have boosters, and they also have antibodies that prevent you from getting COVID. So yes, there are antibodies that can be used to prevent you from getting COVID. Whether that will take the place of a booster, I don't know, and that remains to be seen. Yeah.
Okay.
But yes, they do have. And right now we have the vaccine which prevents the virus, and we also have antibodies that destroy the virus. So we have a full cycle of treatment now, which we didn't have before.
Apparently someone has developed an oral medication, a pill.
Right. We talked about that too. And that pill does exactly what we're talking about. It kills the virus. They have antibodies that do it, and they also have a pill that does it.
But the pill is what you take after you get it.
It kills the virus, right?
It doesn't prevent you from getting it.
No. It kills the virus, right? And that's what Cheryl was talking about. but they have a pill as well as antibody treatment.
Is the pill available now? Has that been approved?
Yes.
Okay.
It's been FDA approved now. In terms of its availability, I don't know about it, but it is FDA approved as an emergency treatment. One thing that this is manifesting is the ability of the scientific community to respond to the viral challenges and the viral changes. And so you can see that within 2 to 4 weeks of a variant, you have a therapy that's directed towards it. Which goes back to Tatum's question, how have we evolved since 100 years ago when we had the Spanish flu? This is an example. And this is the more recent Pfizer test that says the vaccine that we already have neutralizes the new Omicron variant. That's in the laboratory test. That's the early evidence. We have to still wait and see. This is what came out suggesting that this variant is not as lethal as the Delta variant, and that most people didn't require hospitalization. In South Africa, anyway. Any word about who's going to replace Francis Collins? I haven't seen any articles on that, as he's going to leave office as of December 31st.
Wow.
Fauci will still be there, but Francis Collins will not. So that kind of brings us up to date on the Omicron. This is an article that talks about the breakthrough situation that makes even more important the need for boosters for all adults. But as you've already identified, people who got the initial shot who were not willing to take the booster, which doesn't make a lot of sense, but that's the way it is.
Is there a reason why they feel like the teenagers don't need a booster?
Teenagers need a booster.
But it's not approved for them yet, or it is?
It's approved for all adults.
But like the age group 15 through 18, it's not approved yet?
Yes, it is. Yes,
It's
it
approved
is.
for all adults now. Oh, you mean 8? It's actually approved for people above 5.
People above what?
5. 5.
The booster or the vaccine?
Booster. And these are interesting hypotheses, which remain to be proven about whether or not reinfection risk may be higher with the variant. And as time will tell, we'll get the real truth on that. Right now, it's pretty much guessing. Now the 5 to 18 group is a group that has not actually been allowed to have the vaccine longer than 6 months, and so the best test for them is yet to come, because they most of the people between 5 and 18 have not had the vaccine longer than 6 months, and that's the time period when the booster becomes of importance. Although some may say that the need may occur as early as 3 months, but most people will say that it's after 6 months for sure, when the booster becomes more critical. That's interesting that it appears that more people are lining up for booster shots, but the question is, does that mean that more people are going to be vaccinated who weren't initially vaccinated? And that is going to be interesting to see. It's clear now that people who got the first shot, many of them are getting booster shots.
So, Dr. Callender, someone who's unvaccinated and they decided today to go down and get the vaccine, they're going to have to wait to get the second one. You're going to have to wait to get the second shot.
No, the second shot, it's automatic. In other words, not to be vaccinated, you have to get 2 shots.
I understand. I'm saying somebody who decides today that they're going to get vaccinated.
Yes.
They're going to get the first one, then they have to wait 3 or 4 weeks to get the second one, and then
Yes.
6 months later to get the booster.
That's correct.
Okay. Nothing's changed.
Nothing's changed. No. Well, I'm just hopeful that this will result in more people getting vaccinated as well as getting boosters. It's in our best interest.
Dr. Callender, when I go up to Howard, you have to sign in, and so they have some pens that are supposedly clean, and then they have the dirty pens. So you take one of the clean pens and you sign in and you put it in the dirty pens. And they're not doing that globally. So what do you think about that?
Well, we have the same thing at the hospital. I mean, at the church when we go to church, but I just bring my own pen. I think there's a reason for the practice, and it makes sense. But bring your own pen, and don't do it. But it makes sense to. I think it's a good practice.
Dr. Callender.
Consistent with it. Yes, Bonnie.
Can you walk in to get your booster at Howard, or do you have to? Okay.
You can walk in. They have a specific time that they're open, But yeah, you can walk in.
Okay.
I forgot
So
the
I'll go
time
back.
now, but
That's
they
what I
have
got in mind.
prescribed time. But you don't have to do it in advance.
Okay, and you go to the same place
I don't
where,
know if they say the
You
same
go-
place.
You go
You
to the
mean-
main entrance.
You go to the hospital, is that what you're doing?
Yeah, I went to the
go to
hospital.
the hospital main entrance?
Right,
Front
because
door,
the
front
initial
door
shots,
on, yeah.
were not in the hospital.
Yeah,
They were in the
because
college.
I want to go back to where I was originally vaccinated.
Where was that, in the hospital?
At the, it was somewhere in the medical. Well,
College
I
of
want to go
Medicine?
back to Howard. That's what I'm saying.
Okay, well, there are two sites that they were given the vaccine.
Mhm.
They're given the vaccine at the College of Medicine. They were also given the vaccine at the hospital.
Yes, I went to the College of Medicine.
Okay. And I'm not sure exactly where the site of the vaccination is now.
Oh,
Most,
well, I can go there and I can find out. I'll
yeah,
just-
because
Yeah,
most of the people now were doing it at the hospital.
Yeah, it's
Where did
the
you get
entrance-
yours? Okay.
Yeah, the entrance is right on Georgia Avenue. It's
Yes.
the main entrance.
Yeah, that's
You
the
walk
hospital.
in,
Mhm.
It's very simple.
Mhm.
The hardest thing is parking.
Oh, well, don't have to worry.
I got mine at the dental school.
Mm.
Okay.
I got mine at Costco.
Okay. Any other additional comments? You want to make, Darryl, any closing comments? Darryl is speechless.
Oh, no.
That's a first.
Okay, Darryl, give us some good closing remarks.
Oh, well, you kind of put me on the spot. I don't have any.
That's a new one. That's a new one. Carol, did you believe you see the date?
Write the date down.
Beauty, Carol.
So Darryl, you coming to DC next week?
Yes, sir. And I was only kidding about sitting in with your band because the rule I have when people ask to sit in with my band, I say we have a policy where we don't allow that. So I was just kidding about sitting.
No, it's possible. Yeah, you can play my keyboard. It's okay. It just depends on the song that we play. We do a couple of old school tunes that would fit you perfectly.
Okay, so you're saying that I'm an old dude that wants to play. I get
The
that.
shoe fits, right?
No, he's elderly.
Oh,
Mature, seasoned.
season.
Seasoned saint.
Seasoned.
He's a senior. That's what you mean to say.
There you go.
Dr. Callender, can you get a urologist to do a presentation for us?
Sure. Okay. I'll work on that. Yeah, I can.
We had one come before. You remember that, Dr. Williams? She came once.
Yeah, Pamela Coleman.
Coleman, I'm saying, yeah.
Yeah, Pamela Coleman. I'll get her. I got her. She's been very willing to work with us. So I'll talk to her about it.
I have a question for Darryl. Can you tell me what date the podiatrist came? Because I think I was out of town and missed the majority of that. I'd like to listen to the video.
I'll do a search for that and I'll send you an email right after this session.
Excellent. Thank you so much.
Okay, well, see you guys next week. Have a nice week.
Have a good week.
Okay. Joyce, I need to call you.
Came on the 30th, September 30th.
Okay.
Oh, it's September 30th.
Mm-hmm.
There you go.
Janice is on the ball, huh?
No. I remember that one. That one was a good one for me. I learned a lot when, was it Jeter?
Yes, Dr. Jeter.
Okay, yeah.
September 30th. Okay, thanks a lot.
Yeah. Uh-huh.
Okay, have a good week and best to all of you.
Take
All right.
Keep me in your prayers.
Stay safe.
Okay.
Call
Happy
me.
holiday.
Have a
See you
great
next
day. Okay,
week.
I'll call you. Okay. Right.
See you next week.